I'm Dr. Kellye Rice, and today I'd like to talk about myofunctional therapy. So many people think that after their braces as a teenager, their teeth get crooked because they don't wear the retainer, or perhaps because of their wisdom teeth coming in. That is, in fact, not the case. The teeth get crooked again because of the lack of proper tongue posture and improper swallow. That's why with our clear aligner therapy cases for our adults and children, we implement myofunctional therapy for them. That's physical therapy for the tongue. Let's hear more about that from Elaine, our myofunctional therapist.
Hi, my name is Elaine. I'm a dental hygienist and a myofunctional therapist. I'm here to talk to you a little bit about myofunctional therapy today. Myofunctional therapy focuses on the muscles of chewing and swallowing. It also focuses on proper breathing, which is breathing through your nose, and it really helps to reduce improper habits that will lead to major health issues. Myofunctional therapy is a fun series of exercises customized to every person and their needs. I am so looking forward to meeting you and seeing if I could help.